In this video, we want to explore the impact of COVID-19 on children. As far as we know, children are themselves less often affected directly from COVID-19. They get not so often ill, and if they get ill, the illness doesn't seem to be serious in most cases. But does it also mean that children suffer less from COVID-19 around the world? Definitely not. In many countries, children live in very vulnerable situations, which make them very sensitive for example, disruptions in the health system, or because they suffer from the school closures and can't go to school. And they also suffer from increased food insecurity because their parents become poor due to the COVID crisis and the associated lockdown. Or because they are exposed to more abuse and violence. Or because they do not have the proper hand washing facilities to keep themselves and their families safe. And of course, it's not the same for all the children. There are children that are more vulnerable than others, especially those living in monetary poor households that don't have a lot of financial resources, but also children that are often multidimensional poor. In many countries, more than half of the children suffer from deprivations in 2 or 3 or 4 sectors at the same time, or because they belong to disadvantaged groups like refugees, displaced persons, or children with disabilities. Many children around the globe suffer from not going to school, as is illustrated in this testimonial.
Yeah, from Mauritius. I will not go to school for 5 months because of the lockdown. I miss my friend. I miss going out. Also, there are lessons on TV. I'm sure I will not remember what I learned when I go back to school.
Even though children are not the primary risk group of the COVID-19 pandemic, their health, survival, and nutrition are affected in several ways. To begin with, children and their family members with pre-existing poor health conditions face a greater risk of both morbidity and mortality, as well as associated trauma with contracting the virus. Secondly, children's health status is affected with issues with accessibility and availability of healthcare services. The latter may be affected by several factors, one of them being a decline in health-seeking behavior as the caretakers and mothers fear to take their children to health facilities due to contracting the virus. The second one has to do with disruptions in availability or provision of essential healthcare services, such as antenatal care, immunization, treatment of malaria, diarrhea, etc., as the resources from the health system are reallocated to dealing with the pandemic. And the third one has to do with issues with accessibility of healthcare services due to movement restrictions or lockdowns. It is foreseen that 1.2 million children under 5 may not survive in the next 6 months due to disruptions in provision of these essential healthcare services, as well as due to nutritional issues. Additionally, 117 million children in 37 countries may miss out on receiving life-saving measles vaccines. Children's nutrition is affected in 2 ways. To begin with, there has been an increase in food insecurity due to households' loss of income or decline in their incomes from economic shocks that most of the countries are experiencing currently. And secondly, due to school closures, an estimated number of 369 million children in 143 countries are missing out on school meals, which is their main and reliable source of daily nutrition.
As lockdown measures are put in place by governments around the world to mitigate the spread of COVID-19, school closures pose several short and long-term risks to children's educational access and outcomes. Globally, 63% of total enrolled learners are affected by school closures, which disrupt learning schedules and early childhood development opportunities in the short term, and may also have a negative impact on learning outcomes if children do not have access to distance learning materials or if they have an unsuitable learning environment at home. Children may also suffer from the mental health burden of losing access to friend groups and social networks. In the long term, existing inequities may further be divisive in children's learning outcomes, as children in disadvantaged groups may not return to school in pursuit of other economic activities or due to coping measures enacted due to pandemic-related financial shocks to their household. In sub-Saharan Africa alone, around 90% of students do not have access to computers and 82% do not have access to the internet. School closures therefore mean that 330 million learners are not able to take part in distance learning. In Ghana, school closures pose a risk to educational access and learning outcomes, possibly increasing the 22% of primary school-aged children who, already before the pandemic, were out of school. Although the Ghana Education Service has launched a distance learning program, it is likely that the access gap will be widened for the 16% of school-aged children without access to electronic learning devices and for those without network services.
The COVID-19 measurements largely affect the protection of children at home. Children are forced to spend more time in possibly vulnerable and overcrowded household conditions due to school closures, with increased risk of protection violations. As a result of the pandemic, households are facing loss of income, which can lead to higher psychological distress among adults. Children, consequently, are more likely to experience child labor, exploitation, and sexual violence, among others. In addition, it is expected that birth registration will decrease, either because of the closure of facilities or because parents might be afraid to become ill when they go register their child. This will especially be an issue in contexts where the access to public services is already problematic. Also, harmful practices could increase due to the closure of preventative institutions and the redirection of resources. According to the multidimensional child poverty analysis in Ghana, more than half of children 0 to 14 years old are deprived of child protection. 55% of children aged 5 to 14 years old experience violence at home, and among children under 5, 29% do not have a birth certificate. Based on the multiple indicator cluster survey, 28% of children aged 5 to 17 years are involved in child labor, and 7% of girls 15 to 19 years old are currently in union or married.
Hand washing with clean water and soap, partnered with strong hygiene practices and unshared, improved sanitation facilities, are key preventive measures for containing COVID-19. However, access to high quality and improved water and sanitation is limited around the world. This poses a risk of infection and contagion, especially in vulnerable communities. In Africa, only 34% of the population has access to basic hand washing facilities where both soap and an improved water source are observed. In Ghana, more than 80% of children have no access to adequate sanitation, and around 50% have no access to safe drinking water. 59% of the population of Ghana does not have access to basic hand washing facilities at home. Although the government's absorption of water bills and provision of water tankers has helped improve affordability of and access to safe water, it has not adequately reached many vulnerable rural and peri-urban communities without water tanker services. While temporary hand-washing stations have also been erected more extensively, this has happened at a slow speed.
With children suffering worldwide, in health, in education, in nutrition, in protection against abuse and violence, and by not having access to safe water and sanitation. And all this due to disrupted services caused by COVID-19 and the associated lockdowns. There are many reasons for policymakers to consider social policy, and especially social protection policy, that would address these specific problems for the children and reduce, by doing that, the impact of the pandemic COVID-19 on children. Thank you.